In this video, we're going to go through 3 things that you need to watch out for when you're doing your squats, particularly if you're doing squats as part of your back pain rehab program. They're a great movement. They're versatile. They're used in next to everything we do. And hopefully by the end of this video, you'll have a few points that can improve your technique at home and make sure that your squats are more effective and safe for your back. Before we get into it, you might be thinking, do you know what? I can't do squats. There's no chance of me doing squats with my back. It's terrible. It's a bad idea. I'm just going to do some gentle knee rocks or something like that, something simple, because that's the best way for me to rehab my back. I'm just concerned about making it worse. And this really is one of the big problems with a lot of people. They get stuck, they get caught out. And if that's you, if that's something you've thought about before, then you definitely need to watch this video up here or up here to learn a little bit more about why those simple exercises like knee hugs are absolutely the worst thing you could be doing, especially if you've got back pain in the early days. It's worth mentioning, you're going to be doing a squat whether you like it or not, unless you're bedbound, which has its whole host of different challenges and issues with that, and we've covered that in previous videos as well. Then you're going to be moving around. You're going to be getting out of bed in the morning, you're going to be getting up and down off the toilet seat, you're going to be getting in and out of chairs, maybe more into chairs and then staying there for a longer period, which again has its own difficulties, but you are going to be doing a squat. And wouldn't it make more sense to have a sensible approach whereby at a specific time during the day, you focus on making sure that you do that squat correctly in a way that isn't making your back pain worse, rather than saying, hey, I can't do this right now because my back's too bad. I'm just gonna squat in all those other ways during the day because I have to, and somehow I'll just wait until it gets better. So now we've got that out of the way, really getting the squats done is important, and a lot of people, an inability to do these sorts of exercises correctly has at least in part led to the back pain in the first place, or the weaknesses that have then progressed on and caused or prevented the recovery of back pain. In these next 3 tips, we'll go through exactly what you need to do. Write them down, pause the video, save the video, make sure that you take note, because this will help you get these exercises, imperative exercises, done correctly. And the very first one is reduce your ROM. And what does ROM mean? Let's cover that now. Quite often when we're learning a new exercise, when we're learning to do something correctly, when we've got lots of training points that we're learning, it's quite difficult to go through a full range of motion. And what helps is if we break down the range of motion, and that's short for or long for ROM. The range of motion is the range through which we're going to be moving. So if we're doing a squat, rather than trying to go all the way down to the bottom and then come back up again, thinking about your knee position, your ankle position, all these other sorts of things, keeping the spine neutral, keeping the core engaged, keeping your head up, all of these things that are going through your mind while you're going through a full range of motion. Let's start out, because you probably don't have the strength to do that competently, with a reduced range of motion. Now it's worthwhile maybe even pausing this video right now and testing a squat. Stand up, test a squat, a short range of motion, especially when we've got through some of the other tips in this video, because you might find that you can do a good squat to start with, a very shallow range of motion, but that's nowhere near the dining room table seat. It's nowhere near low enough. And if you go any lower, you might start to lose and wobble things. It really gives you an understanding, an idea of just how weak and incompetent maybe these muscles might be, or this movement pattern might be, and how that is most likely contributing to the persistence of that back problem. So starting out when you're learning to do your squats, when you're learning to do this vital technique with a good strong back, with a strong core, etc. Learning with that reduced range of motion, maybe you're only going through 10, 15, 20 degrees of motion to start with. And then from there, over the subsequent days, weeks, months, whatever it is for you, you can start to build up that range of motion. Move towards 90 degrees at the knees. That's something to work towards. And you may take months, it may take longer. There may be other challenges like arthritis in the knees, maybe knee replacements, etc. that will impair your ability to do these correctly. And for those sorts of cases, we want to take certain considerations into place. If you have more severe knee issues, knee injuries in the past, meniscus issues, those sorts of things, then it is going to play a role. But wouldn't it make more sense if you have those injuries, those dodgy knees, wouldn't it make more sense to learn to do a squat correctly in a way that's safe for the knees, rather than just say, I can't do that? Because as we mentioned at the start of this video, you're doing squats every day, whether you like it or not. Let's learn how to do them correctly, and that's really important. So number 1 was reduce the ROM. So number 2 is going to be considering the knees, and this includes the feet to a certain degree. One of the big mistakes that you see all the time when people do squats is that their knees buckle inwards. They might have foot arch problems, the arches drop in, and the knees are driving in towards the middle. They're meeting one another in the middle. And there are a number of reasons for this. I mentioned the arches, I mentioned muscle strength, it could be something to do with the glutes as well. All of these things in reality are likely playing a role in this. It's very unlikely that it's just one thing that is not quite doing its job, because the body is so interconnected and everything is interdependent on the functioning of other areas. If some areas get weak, others invariably follow. So you'll probably see on the screen right now a nice, good knees going through the right range of motion. They're not coming in, they're not coming out. And conversely, you can see here that the knees are driving inwards. Now, if you've got any sort of knee issues, maybe you've got a medial collateral ligament, that's the ligaments on the inside of your knee. Or maybe you've got a patella maltracking, the kneecap doesn't move properly. Or maybe you've got some issues with the meniscus. Maybe you've strained the meniscus, maybe medial meniscus or lateral meniscus, there's some wear and tear. That sort of movement that you just saw when the knees drive in puts stress on all of these structures in ways that the knees simply are not designed to do. And if you haven't got good squatting movements and you're not squatting effectively in those activities that we said you're probably doing anyway, even if you're avoiding doing proper squats, then you're going to be making your knees worse over a period of time. And without the proper rehab, proper understanding and proper technique, you are creating more issues. If we've got bad knees, then that's going to have a knock-on effect on the back and vice versa. So let's feed them in together. Let's be competent. Let's think of our knees when we're doing this. And if you're doing the squats with a reduced range of motion, it'll make you easier to see when the knees go. And with time, you'll find that you can go a little bit lower before the knees are feeling like they want to go in. And then you can just think about that and you can correct for that and make sure that the knees stay in the correct position. Point number 3 is all about the hip hinge. When you're doing a squat, it's a little bit less obvious, but you are supposed to be doing a hip hinge. That means that your spine remains neutral. Your spine doesn't move. Let's grab the spine and show you what I mean. So we have a strict hip hinge, which is maybe a little bit more of an advanced exercise where we're in this position. We've got the hips here and we are hinging about the hips. But when we're doing a squat, we're doing that at the same time. Again, reduced range of motion really helps this. But as we come down, we're supposed to be hinging at the hips. You'll notice that I'm not bending the spine here. The squat doesn't look like that as we come down. That's incorrect. We want a nice hip hinge. So learning to engage your core, using a good core engagement, learning to maintain that neutral spine, not doing any silly pelvic tucking, those sorts of things to tuck the bum under, that's wrong. That's going to make your back worse. It's going to pre-stress and load your L5-S1 and L4-5, more the bottom than the one above. That's going to load those, which is not a good idea, especially if you're learning this squat. So we've got a core engaged, we've got a neutral spine, and we've got that hip hinge as we come through the squat. And as you're doing this, when you're first learning it, that reduced range of motion helps you focus on these little bits at a smaller range of motion, going through a smaller range, especially as you go through the deeper range, adding more range of motion. You're going to find that it requires more competence of those muscles, it requires more strength, and it requires good flexibility and strength in a greatly flexible range of motion. So starting out with a reduced range of motion as we're thinking about these things is really, really important to the effectiveness and the correctness of the technique. One final little bonus point as you are learning your squats, as you're doing these squats, maybe you're new and you're starting to get into some of these routines, hopefully after this video you've been motivated to as well, is don't be alarmed if you start to feel some tension. As you get towards the bottom end of your allowable, your competent range of motion, you're going to feel a few things. You'll often feel that there's a bit of a tension building up in the lower back. And that's because as we get to the bottom of that range, the hamstrings are going to want to pull our spine under. You'll feel this. And what will happen is your lumbar erector spinae muscles will hold that there and a tension will develop here and a bit of pulling in the back of the hamstrings. And that's where you know you're kind of it. There's a bite point between your hamstrings wanting to pull this way and your lumbar erector spinae muscles holding you there. Expect that tension. Sometimes it puts people off. Sometimes it makes them think, hey, am I feeling right here? I'm getting some tension in my back. Is that normal? Is that good? It is something that you should be getting. You should be listening for these sorts of things, feeling these sorts of things as you're doing your squats. In review, these 3 tips actually turned out to be 4, but hopefully you found them really, really helpful. Remember, they're all interrelated and hopefully they'll really help with the success of your squats as part of rehabilitating that back. Don't put them off because you're doing squats anyway. At least you can start doing all those activities of daily living correctly in a way that is as you continue, it's decreasing the negative impact it's having on your back, because doing bad squats inevitably during the day is only going to make things worse. Let's learn to do them correctly. So number one was reduce the range of motion, reduce the ROM when you're learning them. Number two is about really thinking about those knees. And we mentioned on the ankles and the arches as well, keeping those knees in line. We saw a picture, a little screenshot earlier on in this video as well. Number three is going to be that important hip hinge, core engaged, nice neutral spine. And the fourth point was be aware that it's okay to feel a little bit of tension in certain areas. That is the body working, that is your muscles doing their fair share to hold everything in place. And at certain ranges of motion, that's going to kick in and you're going to be aware of that. Hopefully you found this video helpful. Hopefully it's given you a second look or a second consideration for simple exercises like squats. And maybe if you've been on the fence about doing something, you've been too nervous, as is so often the case, too nervous to start and do something a bit more robust. It's given you that little impetus, that little push to get out of the comfort zone and start doing some things that actually make change in your body and will help you with those activities of daily living. If you haven't done them for a while, if you struggle with even a small range of motion with squats, that's okay. Everybody starts somewhere. But if you struggle that much with a small range of squats and you're still wandering around the house, getting up and down out of chairs, in and out of the bed, then God knows what damage you're doing when you're doing those sorts of things. So let's learn to do them right. It may take some time, but the more difficult and the more challenging technically it is to start with, even at simple, very basic levels, the more indication it really is that you should be doing these and you should have been doing them sooner. So let's get started, get it right, and hopefully you really enjoyed this video. Hopefully you did find this video helpful. Consider giving us a thumbs up if you did. Consider subscribing to the channel to stay up to date with all the new releases that we have. And if you do know someone that was struggling with their back, then consider sharing this video. Hopefully it gives them a little bit of light at the end of the tunnel. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune into some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live so you can join us for our next live stream and Q&A.